Urinalysis also in diabetes mellitus, especially in type 1, is also a way to help assess and manage the disease. Abnormal amounts of ketones found in the urine are a sign that the body is not making enough insulin. Diabetes is a disease characterized by higher than normal blood sugar levels. It can be caused by the body not making enough insulin or not using insulin effectively, or both. In type 1 diabetes, the pancreatic islet cells are attacked by the body itself, causing insulin not to be produced or not produced enough, leading to the cells not being able to use glucose and blood sugar levels to rise. At that time, the body begins to metabolize fat for energy. After that process, ketones are also formed and accumulated in the blood, causing the blood to acidify. Too much ketones can lead to a coma or even death. Urinalysis is not commonly used for the diagnosis of diabetes. However, your doctor will ask you to do this test to monitor the levels of ketones and glucose in your urine. Sometimes, you have a urine test done to make sure your diabetes is well controlled. Who needs a urine test in diabetes? Urine tests may be part of a routine checkup. The medical staff will instruct you on how to take a urine sample for them to take to a laboratory for testing. If the results show the presence of glucose and ketones in the urine, the body is not producing enough insulin. Some diabetes medications, such as canagliflozin and empagliflozin, can cause sugar in the urine to rise. Therefore, people who are taking these drugs should not measure urine glucose levels, and if tested, urine ketone levels remain within normal levels. Glucose in urine. Measuring glucose, sugar, levels in your urine is one way of showing how well your body is controlling excess sugar. Normally, the body does not excrete sugar in the urine, unless blood sugar levels are very high. High levels of sugar in the urine can signal that the body is having trouble metabolizing sugar. However, the urine test did not show the current sugar concentration. The results only reflect the amount of glucose in the previous few hours. That's why a blood sugar test is the primary test for determining how much sugar is actually in your blood. Ketones in urine. Ketones, or ketones, are a byproduct from converting fat into energy when cells are unable to absorb glucose from the blood. When produced in excess, ketones can be present in the urine and detected through a urinalysis. Urine ketone testing is essential for people with type 1 diabetes, when blood sugar higher than 300 mg/dl. Have symptoms of diabetic ketoacidosis. Many to 1. Diabetic ketoacidosis is an acute complication that requires immediate medical treatment. Symptoms that indicate you may be at risk for ketoacidosis include vomiting or feeling nauseous, high blood sugar over 250 mg/dl, or 13.9 mol/L, that doesn't respond to treatment, feeling like you have the flu or an infection, feeling tired, exhausted, excessive thirst, dry mouth, frequent urination, fruity breath, the smell of ripe apples due to ketones being eliminated through the lungs, or confused, mentally unstable. Importance of urine testing in diabetes. Monitoring urine ketones is important if you are suspected of having type 1 diabetes. Ketones are also more common in the urine of patients with type 1 than type 2. According to the National Health Service in the UK, NHS, the normal level of ketones in the urine is 0.6 mol/L. Different levels of ketones will indicate potential problems, respectively. Mild to moderate increase in ketones. When the ketone level is around 10-30 mg/dl, 0.6, 1.5 mol/L, it means that the accumulation of ketones is starting. You should check back in a few hours. For the next test, you should drink plenty of water before taking the test sample. Don't exercise if your blood sugar is relatively high. Hunger can also cause small amounts of ketones to appear in your urine, so you should avoid skipping meals before the test. Moderate to high elevation of ketone levels. Ketone levels between 30-50 mg/dl, 1.6 3.0 mol/L, may signal that diabetes is not well managed. At this point, you need to have the appropriate treatment measures. Ketone levels rise very high. Ketone levels above 50 mg/dl, or 3.0 mol/L, may indicate that you have diabetic ketoacidosis. This is a life-threatening condition and requires immediate medical intervention. Ketosis can cause brain swelling, coma, and even death if left untreated. If you are pregnant and have gestational diabetes, it is important to monitor your ketone levels. During pregnancy, insulin requirements can change with hormonal and lifestyle changes. Early determination of urine ketones helps you to know if additional insulin or dietary adjustments are needed. This will keep both mother and baby safe, reducing the impact that gestational diabetes has on the baby, including a large baby. What happens after a urine test in diabetes? If your doctor detects glucose and ketones in your urine, you may need to undergo a few additional tests to find out what's causing the condition. Further tests include blood glucose testing. Causes of diabetes. If you have diabetes, your doctor will create a treatment plan and control your blood sugar through diet, fitness training, using drugs. Monitor your blood sugar regularly at home. If you have type 1 diabetes, you may need to regularly monitor your urine ketone levels with home test strips. If your ketone levels are mild to moderate, take healthcare measures as directed by your doctor. If you detect an elevated level of ketones in your urine, go to the nearest medical facility for prompt treatment. Ketosis will occur when the ketone level is too high. The doctor will then give fluids through a vein and use insulin to treat the condition.